Hello, general psychology students. So the purpose of this short video is to define what a mental health issue is or a psychiatric disorder is, and to talk about the DSM-5. Let me call up the PowerPoint slides. I'm going to share the slides for this chapter. As you know, these are in the Unit 2 folder, and you'll see if you go to the Unit 2 folder and you see PowerPoint slides and click on that, there'll be 3 links. Chapter 11 for personality that you covered last week. Chapter 15, psychological disorders, that's what we'll be covering this week. And then Chapter 16, treatments, and we'll be covering that next week. Okay, so how do we go about defining what is a psychological disorder or what is abnormality? Or abnormal psychology. In fact, if you really like this chapter a lot, there's a class that we offer at Cameron. I believe it's Psychology 4363, Abnormal Psychology. And it takes all of this that we're going to cover in this chapter and some of what's in the next chapter, and it blows it up into a full 16-week course. A lot of students really enjoy it. So if you really love this chapter, you might think about adding that to your schedule if there's room in it. As one of your electives, regardless of what your major is. Many of us, when we think of the term abnormal, abnormal means atypical. It's not normal. Normal is average, what most people do. So abnormal is something that's atypical. But I love the way your textbook brings up having red hair is atypical. It's not, very few people have red hair. I like to think of the example as winning the Nobel Peace Prize. It's not typical. It's very out of the ordinary. It's abnormal if you want to think about abnormality as being atypical, not typical. But we're certainly not going to call having red hair or winning a Nobel Peace Prize a psychological disorder. So what is a psychological disorder? Well, according to the APA, the American Psychiatric Association, there are 4 things that have to exist in order for us to call it a psychological disorder. First, there are significant disturbances in thoughts, feelings, and behaviors. The disturbances reflect some kind of biological, psychological, or developmental dysfunction. The disturbances have to lead to a significant distress or disability in the person's life. And the disturbances don't reflect a cultural expectation, a cultural response to certain events. So I think your book uses the example of eye contact. So in our culture, looking people in the eye when they're talking is something that you're supposed to do. In other cultures, that can be seen as aggressive or something like that. So if someone is doing what is appropriate for their culture, we're not going to call that a psychological disorder. So the psychological disorder needs to be taken within the context of the culture in which it occurs. So all 4 of these things have to happen in order for us to say, okay, this is a psychological disorder. Now, we give names to all of these or to a bunch of different psychological disorders. The names are all listed in this Diagnostic and Statistical Manual of Mental Disorders. We call it the DSM-5 for short. Right now we're in the 5th version of it. Well, it's not really the 5th version, but we call it the DSM-5. The first version was published way back in the 1950s. I know version 3 had then a DSM-3R, a 3rd revised version. So there's been more than 5, but right now, as of 2013, we've been working with the DSM-5. And the DSM changes as we get new information, as the culture changes, as we learn more about treatments, learn more about what creates the disorder. For example, homosexuality was in the DSM initially as a psychiatric disorder. It was removed in 1987, and it's no longer in the psychological community thought of as a disorder in any way, shape, or form. But back then it was. So things change as the culture changes, as we get more information. One way that I like to think of the DSM, in this case, the DSM-5, is it's very much like a listing of symptoms that tend to occur together So then we give that group of symptoms a name. It's not unlike what we do in medicine with the medical model. So if you think of going to the doctor and the doctor says, what are your symptoms? And you tell him or her, I've got a sore throat. I'm coughing a lot. My nose is stuffed up. I keep sneezing. My eyes are watering and I'm achy all over. And then he may ask you or she may ask you, how long have you had these symptoms? And you might say, oh, 3 or 4 days. Are they interfering with your life? Yeah, I felt so crummy. I had a hard time going to work. I was tired and couldn't get all my work done. Tired might even be another one of the symptoms that you described. The doctor might then say, okay, I'm going to label these symptoms a cold. I think you have a cold. Now, other people who have had these symptoms all together, they have responded well to these treatments. So here's some treatments that I'm going to give you, and hopefully they'll work. We now know from more research that the medical community has done that colds tend to come from certain viruses. And so we know how maybe you caught the cold. We know some of the better ways to get rid of the cold. That's a good way to think of the DSM-5 or any of the DSMs. So there's going to be a list of symptoms, and people tend, when they have these symptoms, when they have one or two of these, they tend to have a lot more than just two of them. They come in a group, we're going to give them a name, and that the person now has this group of symptoms, and we know that these symptoms tend to respond well to certain kinds of treatment, and that there's some data that let us know that it might be created from these certain situations, like a genetic predisposition with a particular thing happening. Okay. See, in the example that I'm using, you can see how the person doesn't become their disorder. So you're not depressive Debbie. You're Debbie who right now has a group of symptoms that we're going to label major depression. And for major depression, we know that this drug, along with psychotherapy, tends to really help the person manage the depression well. Much the way we don't refer to someone as diabetic Debbie. We just say Debbie has a group of symptoms that give her that we think means that she has diabetes. And as a diabetic, she needs to take insulin, perhaps, and go on a special diet and moderate her exercise and food intake at certain times and check her urine, or now I think they do it blood tests to check for blood sugar check for sugar in her blood to know whether or not she needs more or less insulin or more or less food. And people who do all that, they're managing their diabetes well, and they can be productive. So we want to think, or an accurate way to think of mental health issues is to think of it very similarly to the way we think about diabetes or asthma or a whole host of other medical issues. Okay, right. That's it for this video. In the next video, I'm going to start talking about actual disorders. In the next video, we'll talk about anxiety disorders.